No, because we don't. All right, what's going on, Trainwrecks? My name is Dominick Juliano, and I am a Beautiful Trainwreck. Today I'm going to be sharing my examination video with you. I traveled to Wayne State Dermatology Clinic to see Dr. Steve Daveluy. Today he gives me some insight into my condition, some possible treatment options. He also discusses things to look out for when you're examining yourself. My greatest hope with these videos, with sharing these videos with other people, is that maybe I can provide some information through my experiences, and hopefully you might be able to make an informed decision about some things that you want to pursue as far as your own treatment plan. So here is my HS examination with Dr. Steve Daveluy at Wayne State University Dermatology. Let's get right into it. If you're new to this channel, hit that subscribe button so you can be notified of the latest content as it's released. If this video has brought you some information and you've resonated with it, give me one of them likes. Okay, we are rolling. We got our ground broken. What's going on? Here we are. We're in Dearborn, Michigan. I'm with Dr. Daveluy and his assistant Kareem, and today we're going to be going over an examination for HS. What I wanted to do was show you all what you go through when you're being examined for HS. So we're going to go over my armpits. He's going to give me his opinion about what's going on, and then we're going to go over some questions and answers and some possible actions that we can take regarding my case. So let's go.
Let's try it each way. You know what I mean? We can do one and then... Okay.
When I was initially diagnosed, did not smoke, do not heavily drink. What's the other one? Obviously, you know, I'm in decent shape. All these things that you notice with HS patients that commonly say, like, the crazy thing is for somebody like me, I don't have any of those. Like any of those things in my life, you know, that a lot of people say is causing HS. So I'm just interested in seeing how this goes.
Yeah. How old were you when it first started?
I was just turned 39, in fact. Yeah, 39 when the initial bumps showed up. And then I was almost 40 when I went to my first residency in Georgia. That's when, like, I couldn't ignore it any longer. Because I was told, you know, hey, don't mess around with this. Don't play games, dude. This is a serious condition. And like most males out there, I was just like, come on, man. I've had all kinds of things happen in my life. I'm like a couple pimples underneath my armpit, and ain't nothing. Within 6 months, I was bleeding. I was in pain. I had to stop school. Took 6 months off from school. It was a life changer, and not in a good way. It was terrible. I could barely lift my arms. I would normally put ice packs underneath my arms just to be able to bear the pain. I did put a few videos out during that time when I was talking about the pain that I was going through. It just, I don't have like a good answer of how this started. Other than I have dissecting scalp cellulitis on the back of my head, and I've had cystic nodular acne all throughout my teenage years. Probably started when I was 11. I had a mustache when I was 11. So maybe, like, you know, puberty brought that on, obviously.
Right.
But as far as the HS, I don't really have an answer of what triggered it.
Right. You know? Have you heard of a pilonidal cyst or pilonidal sinus?
I've had a Here's a story for you. So I'm in basic training. I'm waiting to like start basic training, and I had what was told to me was a pilonidal cyst, and the doc was like, "Don't tell the military because they're not going to let you go to training." And I was like, "Okay." I didn't say anything about it, and I'm sitting in Lackland Air Force Base, San Antonio, Texas. It's 100+ degrees outside, and I'm sitting on a cement slab, kind of like you see out in that parking lot, and it burst. And a fellow trainee saw the red on my pants and was like, "Hey, again, did you spill something on your backside? You know, because nobody knows like that. If you're not going through it, you wouldn't really know. Mm-hmm. And I was like, oh yeah, I sat on something. I took off my BDU bottoms and probably spent 15 minutes. This is in basic training when you're getting yelled at. So I'm in the bathroom. I got my pants off and I'm just washing the blood out of it. And I go back to training like nothing had ever happened. And I can say that people that deal with pilonidal cysts, people that deal with HS, I understand exactly how you're feeling because that was some crazy, crazy stuff. It really was.
Yeah. It's, and like you said, always the worst times.
Yeah.
Always at the worst time.
Yeah, it couldn't be like, when I was on a floating trip.
Right.
My high school senior year, why couldn't that happen? It was a year later when I went to basic training.
Yeah. And then I got some of the outside records, so I know a little bit of the history, especially the surgical history. So you've had surgery in both armpits now,
Correct.
right?
Yep.
Yeah. And both times they did a skin graft, a split thickness
Correct.
Skin graft.
Yep.
How are those doing now?
They're doing good. Would you like to?
Good, sure. And I know for medications, they said it looks like they had recorded the benzoyl peroxide wash, the clindamycin solution, tried the clindamycin, rifampin, doxycycline,
didn't work.
Caflex, and then was on Humira, wasn't working, so then they switched to Stelara, wasn't working, so they went back to the Humira, and now they're trying to get the ixekizumab Taltz approved.
Yeah, I'm on Taltz right now.
Okay.
What can I tell you about Taltz? I can tell you this. Put some ice packs on the area where you're going to inject yourself because you're injecting syrup into your body. It does not tickle. It'd been a while since I cried. Had a good, hard cry. I did one here, and I don't have a lot of fat.
And when you did the Humira, was it the citrate-free?
Yeah. I would pinch my skin with the Humira and barely feel anything.
Especially the citrate-free, you don't feel anything with it.
Yeah.
And then you switch to the Taltz. The Taltz really burns.
I have another one coming up in a week, so every 2 weeks, dude.
Yeah, and like you said, ice the area you're gonna do it.
Yeah.
Keep the Taltz out of the fridge for like an hour to go to room temperature.
Yeah, that probably would have helped.
Yeah.
But I didn't do that. I read afterwards that if you don't let it warm up, it continues to be very syrupy. And that's what causes a lot of the pain. So look for another video of me administering. I did one with my Humira a long time ago, but I'm going to talk about Taltz, how to reduce the pain.
Yeah. All right, this side. Is it active at all? Tender?
Nothing.
Yeah, no, there's nothing.
Nothing.
And that's what I always look at the borders, because usually it's not going to come back in the middle. That's where they remove the oil glands, the hairs, so there's nothing. But yeah, even the borders are really calm. Yeah. A little bit of folliculitis around it, just like tiny pimples. But
yeah, but I've never noticed them like irritating.
They don't progress, right? It's not like that's the beginning of a, because guys, we just get pimples here and there.
Yeah. Yep.
Yeah, and then this side?
This side, I want to say it was right here is where a bump showed up, and then we blasted it with steroids 2 weeks straight. I went in there 1 week, and then right around 2 weeks later, I had another round of heavy steroids.
Yeah.
And I'd say we nuked the whole site, and it's gone.
Yeah, because I don't even feel it. Because that's one of the things I always do with HS is you have to feel. Because you can see part of it, but then as anyone with HS knows, you feel under the surface. There's usually a lot more, but I don't even feel anything.
I don't even feel a scar anymore. But there was sorry.
Yeah, no, go ahead.
There was a big lump. I mean, I want to say it was like that big, and it was full of fluid. And they were like, we're not excising this. We're just going to blast it with steroids. And I'm glad because docs previously have excised them. They've not excised, drained them. Yeah. When they don't need to be drained. And I'm learning more and more that no, if you don't need your sites drained, do not let a doctor drain them because, well, they don't need to be drained.
Yeah.
I'm still questioning if maybe the cutting them open and draining them actually made it worse because I'm reading literature that says that the inside, what's in there, actually gets spread.
Yeah, and it's hard. We don't know. For a lot of people, the draining too, they just come right back. 100% of the time they come back. So there's better ways to do it, like the deroofing. But you haven't had the deroofing, right? No. Yeah, it's pretty simple, and it's similar to the draining. You just take the top off with it.
Okay.
But yeah, the armpits look great. Like,
Yeah.
they're totally not. Are you still doing anything for them, like the wash or anything?
Okay, so I use Seal and Wash. I use, what else do I use? I use my regular medicines, clindamycin, topical. That's looks like a little roller thingy.
Yeah.
Dabber. And then what else? There was one other thing that, I take turmeric pills. I don't know if that helps or not, but I hear that it helps with inflammation. I'm willing to try anything at this point.
Yeah.
It can't hurt me because plenty of people take turmeric.
Exactly. It's healthy either way.
Yeah.
Yeah. Turmeric's kind of interesting. I haven't seen studies for HS, but for psoriasis, there's kind of mixed studies. And they say that sometimes it's because for it to be absorbed, it needs a carrier.
Yeah.
So some of the pills have a carrier and some don't, so they don't, and some of the studies didn't specify. So the ones that didn't work, you don't know, well, did you have a carrier bringing it in so it would work?
Yeah.
Yeah, but like you said, it can't hurt. It's good for you anyway. So, yeah.
So what are you typically looking for? I figure we'll talk about this and then we'll go on there. What are you normally looking for? I think my shoes are away.
Oh, yeah. No, you're fine.
I don't want it to trip over.
Right.
What do you typically say a brand new patient comes in?
Right.
What do they normally say to you? I mean, I'm assuming they have a serious problem. It is now a serious problem.
Right. So the big things I look for on the exam are inflammation and then the scarring in the tunnels. And the reason is, in my head, I'm thinking, all right, inflammation I can treat with medical therapies. I can start some of these antibiotics that might work, some of the biologics we talked about, and that can calm down the inflammation, which is the redness, the swelling, somewhat the drainage too. And then I feel for, and I always ask people about the tenderness first, because the worst thing to do is go in there and start mashing when it's super tender, and that's how you find out it's tender. So I always check first to make sure it's not too tender, and then I'm feeling for those tunnels underneath, because a lot of times, even if the medical therapies really calm it down, if it's formed the tunnels, they're not going to go away with the medicine. They're going to need surgery. And then that helps me to then tell patients what to expect. You know, we're going to start with some medicines, try to get it as calm as possible, and then we might have to do the surgery afterward for whatever's left.
Okay.
So that's the big things I'm looking for on the exam. It also tells me how active it is. Like yours, very calm today.
Yeah.
Some people's, it's really flared up and active, and I always ask them, is this a good day, a bad day, or kind of an average day? Because sometimes it gets better the day before you go to the doctor, and then the doctor goes, oh, it's not that bad. Other times it flares up horrible, but it's been doing good for 3 months, you know?
Yeah. Honestly, that's been my case, because there's been times, not that I'd ever want a flare to show up, but there's been times I've been in the dermatologist's office back in St. Louis, and they're like, you look wonderful, what we're doing is working. I'm like, yeah, it didn't look like this 2 days ago, though. Like, it was just angry and going crazy.
Yep. It's like when you take your car to the mechanic and it won't make the noise. And you go, it makes a noise, I swear.
I drive a 7-year-old Kia. I know exactly what you're talking about. Okay.
And then we usually check all the areas that it can involve, because sometimes people have a little minor involvement in other areas, so we check everywhere. It's not a comfortable exam to do, because it's not something you can just easily show. It feels awkward to be basically naked in front of somebody, but it's important to do it, and it's important to see it and make sure, because like I said, when I see it, then I can kind of make some decisions about what to do today, what to do in the future, what to plan for.
Okay. All right. Well, do you have anything for this area?
I keep doing what you're doing. It's calm now. I always say keep doing the wash, especially because, I mean, you're going to keep it in the shower anyway. It's not a huge extra step in the routine for the morning or evening. But yeah, unless it flared up more, I would stick with the topicals. I wouldn't go with anything stronger.
Okay.
It's a little tricky because with being on the biologic, you never know how much it's suppressing it, which means you never really know if you can come off of it. So sometimes if it's doing really good and calm everywhere, we'll just start spacing out the dosing a little bit to see, is it calm or is it going to flare up? But I usually don't say, all right, it's doing great, let's stop it, even after surgery, because it could come back in any of those areas around there. Like you had the one here.
Like this one right here.
Yeah. Where it flared up right next to it. Because surgery treats the spot that you do surgery on, but it doesn't treat the spot right next to it where it could flare up again. So that's why usually we combine it with the medications. So the medicine stops new ones, the surgery takes care of the old ones that are left over.
Yeah. Right on. What do you think, Kareem? I mean, do you want to go get a hatchet and start hacking away and stuff? I mean, he looks like he's ready to do some surgeries.
Yeah.
You look very ambitious. That's awesome.
Quite yet.
Give it time, man.
Yeah.
We all do things we never expected.
Yeah.
Never in a million years thought I'd drive to Detroit and be doing this. So here we are.
Yeah.
Okay. Well, it looks like we pretty much have a good idea of what I have going on underneath my armpits. Show again. A nice clean scar from skin graft right here, and then over here, kind of a pieced together. I'm really not sure what shape to call that. I think Alaska. That was like the closest I was able to come with. But yeah. All right. So I will turn off the cameras and we'll go on to the next one.
Perfect. Now the real agent.
Yeah. After that recorded portion of the examination, Dr. Daveluy and his assistant, Dr. Kareem, they went on and examined my groin area, and for obvious reasons I did not record that. I won't be sharing that examination. However, it was determined that a surgical intervention, the deroofing procedure, was our best option for treatment. I tried to get as much video footage as possible so that I can share my experiences of the deroofing procedure and give others kind of my perspective on the procedure and what to expect. Thank you all for being a part of this journey. The only way out is through.
Let go of everything.